Big changes are on the way when it comes to your health care. The One Big Beautiful Bill is now law. We're breaking it all down and what it means for your pocketbook.
Welcome to In Good Company, elder care in your backyard.
Welcome back to In Good Company, where we break down the big changes shaping healthcare here in Southwest Missouri and across the nation. This week, we're talking about the newly signed One Big Beautiful Bill Act. It's now the law of the land, signed by President Trump on July 4th, 2025. And it's set to bring sweeping changes to how healthcare is funded and accessed in America. The bill runs 887 pages, and whether you're on Medicare, Medicaid, or a marketplace plan through HealthCare.gov, you're going to feel its effects. Here in Southwest Missouri, where urban hospitals like Cox and Mercy anchor a large rural network of clinics and small facilities, these changes will hit close to home. Let's start with Medicaid, known here as MO HealthNet. Under the new law, the federal government's share of funding for its expanded Medicaid population, people aged 19 to 64 with low income, drops from 90% to 80%. That 10-point difference doesn't sound like much, but it's billions of dollars nationwide and tens of millions here in Missouri. That means the state will have to pick up more of the tab. Lawmakers in Jefferson City will face tough choices, tightening budgets, reevaluating provider payments, and possibly adjusting managed care contracts. And for individuals, this law also adds new community engagement rules. That means able-bodied adults without dependents, and even parents or caregivers of children aged 15 and older, will have to complete 80 hours a month of work, job training, volunteering, or another approved activity to stay covered. If you're on MO HealthNet, expect more paperwork and newly monthly reporting requirements once Missouri rolls out its version of this rule. Miss the paperwork, and you could lose coverage, even if you still qualify. Now, let's talk about the marketplace. The HealthCare.gov plans many Southwest Missourians rely on if they're self-employed, in between jobs, or not eligible for employer coverage. Enrollment season just got shorter. Instead of running until January, the open enrollment window now closes December 15th. That means you'll need to act quickly this year to compare plans and lock in your coverage. Another big change, no more automatic re-enrollment. Everyone has to log in, update their income and address, and actively pick a plan. And that grace period where you could get subsidies while fixing paperwork errors, that's gone too. If you miss a step or forget to upload a document, you could lose the financial help that makes your premium affordable. And speaking of financial help, the enhanced premium tax credits that lowered costs for many families over the past few years will end after 2025. When those expire, analysts say some households could see premium increases between 25 and 50% starting in 2026. So, for listeners here in Springfield, Ozark, Nixa, or Joplin, plan ahead right now. Reshop your plan early, double-check your documents, and budget for higher premiums next year. Medicare also sees a few ripple effects. If you're a U.S. citizen on Medicare, your coverage won't change. But if you're a lawful permanent resident or a green card holder who hasn't become a citizen yet, this new law limits eligibility. In most cases, you'll need to complete the naturalization process to stay enrolled. There's also been talk of possible cuts to Medicare, about $500 billion. But that's not exactly what's happening, because this law increases federal spending elsewhere. Automatic budget rules called sequestration could kick in. Those rules cap Medicare provider payments, not your benefits. So your doctor or hospital could see a reduction of up to 4% in reimbursements beginning in 2026, unless Congress steps in to waive it. In rural communities, that could affect access if smaller hospitals decide they can't absorb the loss. That brings us to one of the most important pieces for our region: rural hospitals. The law expands the definition of what's called a rural emergency hospital. These are smaller facilities that operate in rural or semi-rural areas, providing emergency and outpatient care where larger hospitals have closed. The goal is to keep healthcare available closer to home in communities like Ava, Marshfield, Monette, and Mountain Grove. The federal government has set aside funding, $10 billion a year nationally, to help reopen or stabilize struggling hospitals. These hospitals get a monthly payment just for staying open and a 5% boost in their Medicare outpatient payments. In short, this part of the law is meant to keep lights on and doors open in the places that need it most. So what does this all mean for us here in Southwest Missouri? For low-income adults on MO HealthNet, more reporting and work requirements. For marketplace shoppers, a shorter enrollment window and higher premiums next year. For Medicare recipients, mostly stability, but potential provider strain if Congress doesn't intervene. And for rural communities, perhaps a lifeline through new funding and expanded eligibility for small emergency hospitals. In a region like ours, with one foot in the city and the other in the farmland, these policy shifts will play out in very real ways. They'll affect who can stay insured, how hospitals operate, and what kind of care people can get without driving hours away. We'll keep following how Missouri implements these changes and what it means for families, clinics, and hospitals right here at home. If you want updates on enrollment dates, local MO HealthNet policy changes, or which rural hospitals may reopen under this new law, check the show notes for links to official Missouri health resources. Like and subscribe and give us a 5-star review on your favorite platform. Stay with us as we unpack what's new in healthcare right here in your backyard. If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company, Elder Care in Your Backyard. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.